Hello, my name is Pranav K, and this is my final presentation for ISM. I want to start off with a story about a man named Derek Fidyka, and he believes that he was born again. Derek Fidyka was a Polish firefighter. He is 48 years old, and 10 years ago he was stabbed in the back 10 times. And he lost all feeling below his waist. He was a paraplegic, couldn't move, and had no hope of getting it back into his job field again. One scientist thought that the olfactory bulbs in the brain produced the nerve cells the fastest in the body, and they could regenerate faster than any stem cells and any other part of nerve cells, especially in the spine. And he thought that maybe if he could remove one of Derek's olfactory bulbs and inject it into his spine, that he might be able to walk again. A little bit about him: he was stabbed 10 times and there was an 8mm hole in his spine. It severed his spine completely and he was no longer able to walk. After the surgery, which took 6 hours, Derek is now able to walk with the help of a walker, and even more recently, just with the help of railings. After the surgery, which was roughly 6 months ago, he's undergone a lot of rehabilitation, and now Derek is able to walk with the help of, like I said, walkers, railings, and even other people. I believe this is an amazing story because someone who was a paraplegic and couldn't walk at all is now able to get his life back and get everything back together: his job, his family, and his old life. He's the first person in the world to be recovered from being a paraplegic. So a little bit about me is I'm a senior here at Frisco High School. I am 15 years old. I'm an early graduate. I am the big raccoon mascot. I'm also never at home. I'm always outside. I like being active and being out with my friends. I have one pet, and I'm passionate about wanting to be a spine surgeon. There's my rabbit Peanut, and those are my parents, who I love spending a lot of my time with when I'm outside of the house. So my mission statement is: I want to be a spine surgeon through the ISM program. I hope to gain knowledge regarding surgical practice, learn to accommodate and succeed in tackling the daily challenges that arise while being a surgeon, and to understand all the aspects of professionalism in the medical field. Through this program, I hope to find a mentor willing to guide me in the field of spine surgery and to develop an understanding of the daily life of the spine surgeon. And through this program, I have found a mentor willing to guide me in this field, and I have developed a pretty good understanding of the daily life of a spine surgeon, whether it be the days where he is in surgery or the days where he is just doing rounds. The quote that I chose this year was: "The greater danger for most of us lies not in setting our aim too high and falling short, but in setting our aim too low and achieving our mark." I believe this quote is really influential towards ISM because this course lets us do so much and gives us a huge potential to what we can do, and if we don't strive to achieve the most we can, we're not going to get the most out of this course, which Coach Goff has set out for us. So the reason I took ISM is because I wanted to be enrolled in a class where I could research and extend my knowledge in the field that I want to be in. And I heard about this class from my friend Sophia at lunch when she was discussing how much stress she was under from final presentation. She told me everything about what this class was about and how much she really loved this class and working with Coach Goff and all her peers in this class, and the fact that she last year was working in a hospital as well, and that's something that I wanted to try out. A little bit about my previous experience before I took ISM was I volunteered at Dallas Medical Center, which is roughly 45 minutes from here, and I got this great opportunity because my mom actually works at Dallas Medical Center. My experience there is I shadowed many different professions. I worked in the emergency room, the operating room, the trauma unit, and in the administration. I worked there volunteered there over a 4-year period, and I worked with the anesthesiologists, the spine surgeons, the orthopedic surgeons, the radiology department, and the wound care center. And I really enjoyed working with all of these. Through anesthesiology, I actually found out that I wanted to be a spine surgeon. That's where I actually observed my first spine surgery. And from there is really where I took off wanting to be in spine. Orthopedics was a huge part of contributing to spine because to go into the spinal field, you have to either go through neurology or orthopedics, and I didn't want to study the brain because I don't feel like my hands are stable enough to be able to be trusted with someone's brain, and I don't want to take on that kind of responsibility. So I feel like working with bones is something that I'd rather do rather than working with soft tissue like the brain. Radiology was actually recommended to me by my parents, and they said that radiology was really easy. You didn't have to do anything but sit there and take x-rays, but x-rays is not what I want to do. I want to be able to sit there and help as many people as I can, contributing as much as I can to be able to change people's lives. And the Wound Care Center was really interesting to me because that was what I did over the first year, and I met a lot of the people in the hospital that way, and I found out really how a hospital works through the wound care and the administration. My topic of study is orthopedic surgery, narrowed down to specializing in spine surgery. 2 points of research that I really wanted to focus on this year had to do with stem cells and 3D printing. And I chose these two because I felt they were the most important to me, and that these two are really what I want to focus on going forward in life. So stem cells, especially in the heart, this article was actually titled "The Promise of Stem Cell Therapies is Closer to Reality." And stem cells have actually been promised for over 20 years, and every day there's still the ongoing debate about it, whether it's moral or not, because of where stem cells come from. And mostly stem cells come from aborted children and fetuses and placenta and things like that. But they are used in special cases when the patient allows it, and it's really used for burn victims more than anything to help regenerate their skin and get them back to normal. But this was another special case. This was a huge exception. This man, he was in his 40s, and he had a heart attack, and 1/3 of his left ventricle was blocked, and the left ventricle is responsible for pumping reoxygenated blood back into the heart to get it out through your aorta, which is the largest artery coming out of your heart. And 2/3 of that 1/3 block was actually cured through the use of stem cells. They injected it directly into his heart and had them eat away at the tissue and rebuild it with cardiac muscle. I found this really interesting because even though that this doesn't relate to the field of spine surgery, stem cells in general are definitely one of what I want to be working on going into the future, and especially with people like Derek Fitica, stem cells and their olfactory bulbs could be really helpful towards helping paraplegics and quadriplegics and people who have lost feeling or lost movement in certain parts of their body. 3D printing is a little controversial because it's not actual medical technology that's been certified, but in special cases it has been used a couple times in Brazil and a few times in China. This was a special case that I wanted to talk about. It's with a 12-year-old named Ming Hao in China, and he was playing soccer one day just out, and he tried to head the ball into the goal, and once the ball came in contact with his head, everyone heard a crack and he fell over on the floor. He couldn't move. They went and called his parents, and his mom rushed him to the hospital. What actually happened was there was a tumor behind his C2 or C3, which is the third vertebra down, and the doctors couldn't get to the tumor without removing a vertebra, and they had no equipment to replace his vertebra, and he was basically just going to have to sit there in pain with a tumor unless they could find something to do. One of the doctors actually came up with the idea to 3D print a titanium vertebra and to replace the vertebra in his back. So what they ended up doing was they dislocated that part of the spine from the rest of the body. They severed it, took out the tumor, and then replaced his vertebra and reconnected it to the rest of the spine and the rest of his body. And he is now actually able to move again. He's fully functional after 7 months of rehabilitation. He can move again. He is out there playing soccer, and he's just another happy 12-year-old boy. I found that really interesting to me because being able to help someone like that and change someone's life is huge for me. And even though my parents or I don't have any real reason to be doing it, I feel like I want to give back to the people of this world, and because I've been given so much. So going on to my mentor interviews, my first interview was with Dr. Samir Parikh, and he actually owned a private clinic not too far from here. He really discussed with me the life of a surgeon, and because he was a private clinic and he was the only spine surgeon there, he was really close with all of his patients. He knew them all by name, and he knew every single problem, never had to read the folder. I found something really interesting about him was that he was really casual at his workplace, and it seemed really off to me given that I used to volunteer in a hospital setting, but he worked in button-up t-shirts, and flannel, rolled his sleeves up, jeans, cowboy boots, And obviously not on his surgery days when he would wear scrubs, but just doing rounds, he seemed really comfortable with his patients, and he told me that one of the most important things is to be comfortable with your patients so that way they can be comfortable with you. And that was really inspiring, because if you're not comfortable with your patients and they don't feel like they can talk to you and express their problems to you, then nothing can really get solved. My second interview was with Dr. Daniel Bradley. He was introduced to me by a friend. I was really impressed with a lot of the values that he said, and he doesn't believe in doctor-patient like superiority. He doesn't feel like he's above the patient. He feels like the patient is actually above him, or that they're on the same level. And he feels like the patient really needs to know what's right for them, and he can only suggest ideas, and the patient should really be the one making all the calls and all the options there. He has a really fun personality. He's always upbeat, and he has a great sense of humor. And his work environment, which is Forest Park Medical Center, is a great work environment where I've met plenty of surgeons there, the anesthesiologists, the nurses. Everyone's really nice and friendly there. Interview number 3 was with Dr. Venkat Sethuraman, and he had a really negative outlook on the medical field in general, especially spine surgery. He said that it was a dying field and that we're never going to need it in the future, and he said that you shouldn't become a spine surgeon, you shouldn't even become a doctor, because we're not going to need them in the future, because everyone wants to become a doctor, and college is just not going to let that many people through, and it was just going to be really, really hard to go in and become a doctor. And he just said, don't do it, just go be like an engineer or something. But I took a really positive outlook on what he said to me, and he said that it was going to be difficult, and I accept that, and I'm going to work as hard as I can to become a spine surgeon. And given that spine is such a tasking field and it's really difficult because of all the specialization there, I really want to put forth my best foot and try to become a spine surgeon to help all the people I can. My 4th interview was with Dr. John Pelosa, and he was really easy to get in contact with. He was actually the first person I was able to get in contact with. Our interview lasted about 2 to 2.5 hours, and then after that he invited me to a conference out in Plano at Plano Presbyterian Hospital. He was really excited to see someone so young, given that he's not the youngest guy, but he's excited to see that someone in high school, especially me being really young, knew exactly what he wanted to do going into college and coming out of high school. And he really wanted to have me talk to a lot of the fellows that were at the hospital to get an idea of what it was like coming straight out of college and medical school, and how the field is like now for newcomers. And the conference he invited me to is actually with a professor from the University of Connecticut, and he came down to talk about stem cells as well, which is something I'm really interested in, and that's why he invited me. My 5th interview was with Dr. Douglas Wan. He came highly recommended to me by both of my parents, actually, because my dad used to go see him. He quit his job as a surgeon to become a businessman, and he felt like he could really help more people in business than he could as a surgeon, because as a surgeon he could only help one person at a time during surgeries, but as a businessman he could hire different spine surgeons and pull the clients who needed him. So he started a company called Spine Care, which is out in Dallas. It's actually in the southwestern area of Dallas. And what really touched me during my interview with Dr. Wan was he was motivated by his father, because when they moved here, or when his father migrated to America, he had spine problems that they couldn't fix back in his country. And when he came here, he saw how much improvement that his father had through all the surgeries and things like that, and he wanted to be able to better people's lives and help people just the way his father was helped. So my mentor is Dr. Daniel Bradley, and I chose him because we share a lot of values, the equality of doctor and patient, and because he has 2 locations in Frisco, which allows me to go to different places, meet new people, and still be able to have the same experience I would with the same mentor. Some of the huge highlights of this mentorship were the conferences. I've been invited to 3, and then I got to see something called, what they do is questionable cases, and I got to see that once, and I got to watch a surgery which lasted roughly 3.5 to 4 hours. And I thought this was, the coolest thing I've done in my mentorship. So the 3 conferences that I went to were stem cells from the UConn professor that I said earlier, and he came in and he talked about how stem cells were changing and how that they're becoming closer to being a reality, and that probably sometime in the next 2 to 3 years that stem cells will actually be used in surgeries on a daily basis. The second one I went to was called Spinal Fixations in Older Patients with Dr. Dilip Sengupta. And he basically said that a lot of the older patients have worse spines with not breaking and not degenerating, but more of scoliosis, kyphosis, and lordosis, which are just different ways the spine bends. And he felt like if doctors knew the easiest ways to fix this, which was what his presentation was over, that a lot of the older patients' problems would be gone faster and their rehabilitation would be quick and painless. And the third conference, that I went to was called When the Patient Isn't a Partner. And that was a 2-hour presentation, and it really opened my eyes to see how much surgeons have to deal with patients, and it made me feel like I could be a better person to my doctor and a better patient to my doctor if I ever went into surgery or had problems. And it was really how patients are really uncooperative, or if they don't take their medications or they don't do what the doctor tells them to, they skip rehab appointments, they are just really rude a lot of the times to the doctors and things like that. And this conference was really over what doctors can do to deal with these kinds of patients and what they should do, if they should recommend them to a different doctor, or really what's going on with the patient and see if they can fix it. The questionable cases was also something really interesting. It was a lot of doctors who gathered together in a room, all part of Texas Back Institute, which is where Dr. Bradley is part of. And the questionable cases are where the doctors get together and they talk about cases that would have been really difficult for them and what choices they would have made. And they kind of have a little game that they go on, and it's, what would you have done in my situation? And all the doctors go around and they go in a huge circle before the doctor who actually did the surgery answers all the questions. And everyone really agrees with that doctor and said, you made the right decision. Good job for what you did. And everyone really backs each other up, and they're a really motivational group. And the surgery that I got to watch was a really interesting one because I'd never seen this kind before, but it was a replacement of hardware in the lower spine. And it was a really difficult surgery from what it seemed like. It took 2 surgeons to perform, and it was really difficult for the surgeons because the patient was a little bigger than normal, and the hardware was about 7 to 8 years old from what it looked like, and replacing new hardware, they had to hold the spine in place while they pulled out the old hardware. So it was a really complicated case, and it was really fun to go watch, and it was a great experience to be there for. For my original work, I decided to make a website to inform people of the few common spine surgeries and the information of the post-op recovery. So this is the front of the website. This is what it looks like. There's just kind of a decent picture of a spine there, and it says this site is designed to help people gather information and increase their knowledge on the different types of spinal procedures. And here you'll be able to acquire knowledge on how different procedures are done and the risks associated with the surgery and the post-operation. So the different procedures that I have on there currently are spinal fusion, disc herniation, and disc decompression, which are the 3 most common spine surgeries that we see in the field today. So just going through the spinal fusion section, it just describes what it is. It's one of the most common spinal surgeries. It's a surgical procedure used to correct problems with the small bones of the spine, which are called vertebrae, and it's essentially a welding process. And the basic idea is to fuse together the painful vertebrae so they heal into a single solid bone. And it's normally used to relieve symptoms of many back conditions, including degenerative disc diseases. I can't pronounce that one, but it's basically the vertebrae slipping onto the one under it, and it's the overlapping of vertebrae, which causes a hunchback. And spinal stenosis, scoliosis, lordosis, kyphosis, and then fractures, infections, and tumors. Like if they have to remove the tumor and remove part of the vertebra, they fuse it together with another one to make sure everything heals properly. But it becomes a little bit of a problem because then there's no disc in between or soft cushion in between to let them bend properly. So here we have the complications, and as with any operation, there are always going to be risks. And it's important to discuss all the risks with your surgeon before your procedures. And I said note that these risks do not always happen, just to make sure people aren't super scared of going into surgery. So infection is always a common complication because you're an open wound in a sterile room most of the time, but sometimes, if someone in the room is sick, you could get infected. So antibiotics are regularly given to the patient while they're under, and all the time after surgery, just to make sure that they don't get infected while they're healing. Bleeding is a huge problem. A certain amount of bleeding is expected, but if it's a significant amount, they might have to pump blood back into your system because a lot of patients, or some patients, especially those with hemophilia, don't heal correctly. Pain at the graft site, a small percentage of patients will experience persistent pain at the bone graft site, and it's just constant pain that you have to live with, but most patients live with it because it's not nearly as significant as the pain that they had to live with before. Sometimes patients have reoccurring symptoms, like if it's a tumor, the tumor might grow back if the doctor doesn't completely cut it off correctly. And scoliosis, lordosis, and kyphosis, which are also different bendings of the spine, lordosis being forward, kyphosis being the top going down, which is a hunchback, and scoliosis being the bottom of your back bending forward. And so a lot of these are genetic, so even if you do fix them, they do end up trying to go back to that shape because that's what your spine is genetically encoded to do. And then pseudoarthritis, which isn't really arthritis, but patients develop it and it's just like arthritis, but there's not enough bone formation and instead of joint pain, and a second surgery may be needed if this happens to obtain a solid fusion. Nerve damage is also a possibility that might happen if the doctor doesn't do everything correctly. Given he is working with your spine, it is not the easiest bone to work with or group of bones to work with because it is protecting the biggest nerve in your body. But a lot of the times the surgeons are really good and these complications are very, very rare, and it's 0 to 1%. Blood clots are another uncommon complication, but blood clots can form in your arms and legs because they are your appendages. And they do pose a significant danger if they break off, and they might travel to your brain and cause a stroke, your lungs and stop breathing, or to your heart and cause a heart attack. But doctors normally try to avoid blood clots as much as possible by giving the patient aspirin or another blood thinner. The second tab under spinal fusion is rehabilitation, and the fusion process takes time, and it may be several months before the bone is solid again, although your comfort level will improve much faster. And I said during this healing time, the fused spine must be kept in proper alignment, and you'll be taught how to move properly, reposition, sit, stand, and walk. If the growing bone fuses to another vertebrae, a second surgery may be needed to unfuse those two bones because your healing is too fast and will limit your movability and able to walk, and it'll be very painful to sit, stand, and walk. The symptoms will gradually improve, so the activity level right after your operation will be very, very low. The doctor will recommend light activity, and like I said, with the patient being a partner to the doctor, they should cooperate, and they will regain strength over time, but they shouldn't go back to work for anywhere between 4 to 8 weeks, depending on how long the surgery was and how much complication the doctor had with it. From there on, you do have to maintain your diet, because typically bigger patients have more problems with their spine because their spine can't handle all the stress on their back. And the third tab is actually the surgery and what happens during the surgery. And I said the lumbar spinal fusion has been performed for decades. It's been performed for like 30 to 40 years. And there's several different techniques that doctors use, and each doctor really has their own way of going at it and which way is easiest for the doctor, and there's no right way to do it. But different surgeries have to come from different angles because of where the spine needs to be fused, whether it be the front, the side, or the back. So your surgeon might approach from the front, which is called an anterior approach, or an A-lift, and requires an incision in your stomach where they move all the organs aside, and they kind of like push everything aside and pull your spine forward, fuse it, and then put everything back to where it belongs, which takes the longest time to rehabilitate because of everything that they're moving around in there. And then a posterior approach is done from your back, or your surgeon might approach from the side, called a lateral approach, or an L-lift or a T-lift, depending on which side they go from. And most surgeons use minimally invasive techniques, which is, Dr. Bradley says, just a fancy business term that they use, and it's just spinal surgery done with the least amount of incisions and really small incisions that they can do. And the right procedure for you will be depended upon by your surgeon and the location of what needs to be fixed. So a little more about my original work. The website is up and live, and it will constantly be updated, and I will continue to update it throughout the rest of high school, through summer, through college, and even after college. I will do my best to keep that updated and adding more surgeries. My product proposal was to create an iPhone app that teaches patients on how to rehabilitate at home, and it will just be a free app, and all information will come from either trusted websites on the internet, a physician, or my mentor. So my product has changed a little bit from what it started as. It will no longer be an iPhone app, but it's rather a computer website, but everything will still look the same, and it just won't be able to be put on the App Store. So there's two applications that I'm using for this, and the first one's called Make Human, and the second one's called Blender. And Make Human is a really complicated tool, but it allows you to make a human from anything that you want, with any diseases, any looks, and it's completely anatomically correct, which was a little bit disturbing to work with at first, but I ended up getting the hang of it and able to make a lot of different people to use and animate, and with different spinal problems and things like that. And Blender is the application I've been using to animate with, and you basically move the file from Make Human to Blender, and you're able to drag different limbs around, and you're able to make the person do different things. So here's a picture of what I've been doing, and I was actually getting the trainer in this picture to teach her patient how to touch their toes. And as you can see, she's kind of like bending over and showing them how to touch their toes without moving her spine, like keeping her spine completely straight at the top. And I put an exercise ball on here just to talk to you guys about that. And the exercise ball is actually a really, really important part of fixing spinal structure. And not right after surgery, but ways down the road, sitting on exercise balls actually improves your posture and helps your spine get stronger. And rolling on exercise balls with rehabilitation can actually better your rehabilitation and quicken it. Not right after surgery, not 4 to 8 weeks, but maybe a couple months down the road after surgery, once your spine has been able to hold its weight again. And I'm actually using a third application called GIMP to make all of these into GIFs that I'm able to put on the website and make sure they all animate correctly. The purpose of my product is to help those wanting to get better on their own at home and to help people strengthen their spine. So just a little bit about what ISM has done for me. It's helped me develop a lot of skills. It's piqued a lot of my interests in this field, especially with 3D printing, advanced technology, and especially stem cells, which I'm really looking forward to working with and researching in college and medical school. And it's given me a great deal of experience and helped me ease my foot and get my foot into the door in the professional world. And I've been able to meet a lot of doctors that I've wanted to stay in contact with and that have wanted to stay in contact with me throughout college and medical school. I feel like through ISM I've become a better speaker and a better interviewer. I'm not as shy as I was when I started this class. I'm getting better with confrontation. I'm able to go up and talk to people without having to stutter or say. I'm able to be really confident, and it showed me what I really want to do with my life, and that I really want to go into spine surgery, and that this is the field for me. Some of my future plans are to major in either biology or biochemistry. It's sitting at biology right now. And attend UT Dallas for the first year, if not all 4 years, because this college is really research oriented, and that's something I'm really looking forward to. I want to definitely focus on research throughout all 4 years in college, if I don't take 5 years and put a year towards research. And I definitely, after college, want to live in a rural area, out in a farm or a ranch, and I just really like being open with nature. Are there any questions?
Why did you choose UT Dallas?
Because it's really close to home, and my parents actually wanted me to go there, and there's a large Indian community given I'm Indian, so I'll make my parents feel a little more comfortable with me going off to college at such a young age. And it's really research oriented, and they have a great biology major. Thank you.